Hello there. I'm happy to be here to share Canada's experience with you, although they're not all that different from the ones I've heard so far today. In Canada, we work under the Canadian Environmental Protection Act, and this law was first passed in 1988, and we did amend the law in 1999. We haven't been very successful in amending it since, but we're still working on it. It provides the regulatory framework for information collection, risk assessment, and risk management of both new and existing chemicals and organisms in Canada. It has provisions for assessment of existing chemicals and requires that every new substances made in Canada or imported into Canada be assessed against specific criteria. It requires that the Minister of the Environment maintain an inventory of the existing substances in Canada, which we know as the Domestic Substances List, or the DSL, and that's the sole basis for determining whether a substance is new or existing in Canada. SEPA 1999 required the Ministers of the Environment and Health to categorize the approximately 23,000 substances that were on the DSL according to specific criteria to identify priorities for future assessment work. Categorization represented a priority setting exercise, and it involved the systematic identification of substances that should be subject to screening assessments and management controls if applicable. So this is a schematic of the categorization criteria that appears within SEPA. So we started with 23,000 substances on the SEPA's domestic substances list. The boxes in green were addressed by Environment Canada, so they looked to see which of those 23,000 substances were either persistent or bioaccumulative, and which of those were inherently toxic to non-human organisms. The yellow boxes were done by Health Canada, and so we looked to see which of the 23,000 substances posed the greatest potential for human exposure, and also which ones were inherently toxic to humans. So to do this, we used some simple tools for both exposure and hazard to really try to focus on identification of the highest priorities. So for the decision regarding which substances had the greatest potential of exposure, we focused on 3 lines of evidence. We looked at the quantity in commerce, the number of submitters, and the use codes or the uses of the substances that were identified. Now this was based on the data that was given to us from 1984 and 1986, so it was old even at the time of categorization, but it was the only information that we had for every substance on the DSL, so we could compare equally across all of them. To identify hazard, we did a lot like what Gina's doing. We did a list matching exercise. So we focused on substances that have been classified by other agencies as carcinogens, mutagens, or reproductive toxicants. And when we combined our priorities with those identified by Environment Canada, we identified 4,300 substances for future assessment work. So as categorization wrapped up, Canada's Chemicals Management Plan was announced. The Chemicals Management Plan is the Government of Canada's response to the Strategic Approach to International Chemicals Management, or SACM, and it's designed to meet the 2020 goals set by the World Summit on Sustainable Development for the Sound Management of Chemicals. The CMP provides a framework for assessment and management of the priorities that were identified through categorization, among other things, and it integrates multiple federal programs into a single strategy to ensure that the chemicals are managed appropriately in order to prevent harm to Canadians and their environment. So this is just a brief status of our past, present, and future under the CMP. So the first phase of the CMP ran from 2006 until 2011, and during that time we addressed our highest priority substances, and we initiated work on our low priority substances, and I'll talk a bit about that in a minute. The second phase of the CMP is our present. It runs from 2011 to 2016, and the major focus of this is the Substance Groupings Initiative. And the third phase of the CMP will run from 2016 to 2020, and at that point we will be addressing the remainder of the 4,300 priorities. So in the first phase of the CMP, as I mentioned, we looked at the highest priorities for action. And this was about 500 substances that either met the persistence and bioaccumulative and IT criteria from Environment Canada, or they had high exposure potential and high hazard concern for human health. The high priorities for action were addressed through 3 different mechanisms. So there were about 150 substances that were persistent and bioaccumulative and inherently toxic, but they were no longer found in commerce in Canada, according to surveys that we did with industry. And so for those substances, we published SNACs. This is a significant new activity. It is very similar to a SNR in the US, which means that if anyone wants to use these substances, they need to notify us before they can do so. About 200 substances were high concern and were found to be in commerce, so these were assessed under the challenge program. And this consisted of essentially a lot of individual screening level assessments on substances. For another 160 substances, they were all found to be used within the petroleum sector. So we developed a focused sectoral approach to deal with these substances. So this diagram shows what that approach looked like, and I'm not going to go through all the details, but I wanted to show it to you because it's an example of how we did exposure-based prioritization or exposure-based tiering. All the 160 substances that were in this stream were put into streams based on their exposure potential. So for example, substances that were site-restricted petroleums were put into stream 1 because they had low exposure potential, and substances that were used in consumer products are in stream 4 because there's a much higher exposure potential. And then the assessment approaches that we used to deal with these substances were tailored according to those exposure potentials. So while we were going through the high priority substances, we also tried to initiate work on the low priority substances. And this is another example of an exposure-based prioritization method. And in this, the premise really is no exposure equals no risk. So we wanted to focus on this early in the CMP because it allows us to identify substances with low concern so that we can really use our resources to deal with those substances with higher concern. So a number of substances were identified through categorization as priorities, but they had a low potential for risk due to low volumes of use in Canada. And that they could have been reported originally with low volumes, or the low volumes may have resulted from a shift in market since the 1980s. So Environment Canada addressed these substances by doing worst case modeling to calculate predicted environmental concentrations and compared those with toxicity values. For Health Canada, we did not try to quantify exposure, but we tried to identify which substances had no or very low exposure potential. So to do that, we followed this sort of flow chart. We looked for whether the substance had potential for indirect exposure. And really, if a substance is used in commerce in low quantities, the potential for a high or significant exposure via environmental media is very low, so that was not an issue for these substances. But we also looked for whether the substance had the potential for direct exposure, that is, was it used in consumer products? Because for substances that are used in consumer products, even if there's only a low volume in commerce, there could still be a high potential for exposure if the substance is applied directly to your skin, for example. So if we found these substances that did not have potential for indirect exposure, or they were not used in consumer products, we considered that these substances did not meet the criteria for toxicity listed under Section 64 of SEPA, and therefore we did not need to do further assessment work on these substances. So 3 assessments on about 1,200 substances have been completed using these approaches. The assessments were published in April, May, and June of this year, if you want to check them out. The results indicate that approximately 700 of these substances need no further assessment work. The remaining 500 will be considered further in future assessments. And we expect that we will be using this approach again to deal with as many substances as possible once we collect current commercial status on the remaining priorities. So as we were wrapping up the first phase of the CMP, we had to figure out what our priorities were going to be for the second phase. To do this, we considered a number of things, including the potential hazard and exposure that the substances posed. So we looked to see if any of the remaining priorities had high hazard flags, or whether they were internationally classified for health endpoints or high volume persistent inherently toxic substances. We also looked to see if they had a significant exposure potential, and that was based on recent inventory survey data or monitoring information. And then because through the challenge program, we found that doing single individual substance assessments was not always the most efficient. We tried to build groupings around these priorities to see if we could improve the efficiency and the effectiveness of our assessment work. We built these groupings both for risk management purposes and for risk assessment purposes, using a number of different factors. And we also considered scheduling implications. So we wanted to look for the availability and timing of international information. For example, if we're expecting a major assessment report from the US, we would like to time our assessment report to either be closely related with that or maybe even follow it. We also looked for the ability for stakeholders to participate. So we tried not to align all of our metals groupings, for example, at the exact same time because they'd be overwhelmed with having to input data. So we came up with a number of groupings in the Substance Groupings Initiative, and it covers about 650 substances. The aromatic azo and benzidine-based substance grouping is by far the biggest, with over 300 substances. There are a number of metals and a number of high priority substances, flame retardants, phthalates. The last one, the certain internationally classified substance, isn't actually a grouping. It's just a group of individual substances, again, like the challenge substances that we felt warranted work at this time. So this is just an overview of the categorization approaches or the assessment approaches we've used to deal with the categorization priorities. I've talked to you about the PBIT snacks, the challenge substances, the substance grouping initiative, and the petroleum sector stream approach, and the rapid screening. We feel that there probably are, probably an extra 200 substances in our priorities that will fit really well into the petroleum sector stream approach. So we expect that we will deal with those substances in that manner. We are also hoping that there will be another 700 substances that will be eligible for rapid screening, so we can remove those from the priority list in that manner. We have about 700 polymer substances that we're dealing with at this time. We're trying to develop an approach to deal with those. But that leaves about 1,000 substances for which the assessment approach is yet to be determined. So we're moving toward the middle to the end of the second phase of the CMP. So we're trying to think now about how we're going to approach the third phase. It's not so much about selection anymore because we have to do what's left, but we have to figure out what the best way to do that is. So again, we're looking at how to group these substances based on either structure, mode of action, functional use, or possible substitutions. We're also looking at what the potential exposures are. So what is the commercial status in Canada at this time? And we're currently doing an update of our DSL inventory. So we're asking industry to provide us with information on how much is in commerce and what are they using it for. So how is it being used? Is it in consumer products? Because that is really important to us. And has it been measured in environmental media or biomonitoring studies? We're also looking at the availability of toxicity data. So is there empirical data out there on these substances? How much? Is it positive or is it negative? What endpoints are involved? Is it just cancer, or is there cancer data, which would be great, or is there just irritation data, which is not really that helpful in an assessment, although important? Is there high throughput screening data available? And what can we do with it? And then scheduling opportunities. So trying to identify possible opportunities for international collaboration and alignment with data generation. So if Richard's coming up with some great new high throughput stuff, we need to wait until we get there to be assessing those substances. I'm gonna go through this really quick, but so just as an example of data availability, you saw one earlier this morning. We searched ToxLine for all the 2,300 remaining priorities, and as you can see, 53% of the substances had absolutely no hits, which is not a good sign. 18% had very few hits, and because ToxLine's not only relevant to human health, typically that 18% will join the 0 hits when we go through the actual data. So that leaves us with only about 29% of our remaining priorities that have actual empirical data that we can do things with. I know this is only one source, so there may be other data out there, but it really highlights the need for the innovative assessment approaches involving the high throughput screening data and/or modeling. So while we're doing all this, we also recognize that scientific understanding of exposure and toxicity continues to evolve over time, and we can't just stop with the categorization decisions or priorities. We have to continue to update our list of priorities. Traditionally, we use 7 feeders for the identification of priorities. We use categorization decisions, industry information, decisions by other jurisdictions in Canada, international assessments or data collection, public nominations, trends that we see in the new substance notifications coming in, and emerging science or monitoring data. And we're currently looking for a way to make this process more systematic so that we can ensure we're looking at all the appropriate pieces of information and in a timely manner. So I just have one more slide, which I'll go through super quick because I've already been given my warning. But I noticed a lot of limitations to conducting a priority setting exercise on old data, but it is often difficult to get new data. There is a lack of approaches out there for modeling substances other than the generic organics. So when it comes to the inorganics, UVCBs, and polymers, for example, if we don't have empirical data, there's not a lot we can do with these substances. We found primarily that direct exposures or consumer product exposures really drive our assessments. And we typically have to use worst case models to develop scenarios for these substances. And we refine it if the data is available, but what we found is that it is really often not easy to obtain data to refine these scenarios, as Gina was saying. I'll skip to the bottom. So substance by substance approach is less efficient, is what we found for both risk assessment and risk management. However, we've also found that assessment of substance groupings can also be quite challenging, especially groupings that are built for one purpose are not always well suited for another. So if we build a grouping based on informed substitution, the risk assessment is often quite challenging because those substances could have very different exposure patterns or very different hazards. So that's all, and I would encourage you please to visit our website, and there's a listserv if you'd like to sign up, and they will send you automatically any publications or announcements of things that happen under the CMP.
I understand that Canada has a secret plan to take over the United States. She didn't mention that. Like everything else, it's probably mixed. Thank you for your question, Frank. Christina France is the Senior Director of Regulatory and Technical Affairs at the American Chemistry Council. A distinguished lawyer, she is a policy advocate on health and chemical regulation issues affecting ACC member companies. She concentrates in depth on the Toxic Substances Control Act, the High Production Volume Program, and product stewardship issues. Please join me in welcoming Christina.